Welcome back to WKRG News 5 at noon. The doctor is in. Today we're joined by Dr. Kimberly Donnellan, who is a facial plastic and reconstructive surgeon with USA Health. Dr. Donnellan, thanks so much for being with us today.
Hi, thank you.
You were just telling me you were in the brand new office there on Old Shell Road next to Old Dutch, and USA Health has really expanded in Mobile. So good to have you with us today.
Thank you.
All right, let's talk about some of the most common procedures that you perform as a facial plastic surgeon.
Yes, so for procedures as far as surgical, I would say facelifts and eyelid lifts are probably the most common procedures we perform.
So a lot of people might be watching and wondering, well, if you have an eye lift, for example, what is the recovery time for something like that?
Yeah, the patients are often pleasantly surprised. I mean, my patients don't even often need pain management. They don't take pain pills, and it's like a week of recovery, and we take the sutures out, and that's about the recovery time.
Wow. And then for a facelift, imagine a little bit longer?
Yeah, probably right at 2 weeks, but again, not a lot of pain meds needed, and very comfortable procedure, just a little bit of bruising and a little swelling.
Okay. Now, some people might think, well, I don't know if I want to go under the knife. So what are some of the options for those folks?
Yeah, I think the most common procedures right now are laser therapy and microneedling, and those treatments have come a long way over the past few years.
What is microneedling?
Microneedling is a device where we use radio frequency, which is heat energy, and then sterile little microneedles that go into the skin, and it promotes collagen building. So as we age, we lose collagen, and so those procedures kind of plump the skin and address the wrinkles and lines and kind of tighten the skin.
Now, are there some numbing medicines used before you start those procedures?
Oh, yes, we apply numbing medicine before, and the procedure is virtually painless.
Oh, okay. And now, one thing we were talking about earlier is the prevalence of skin cancer here along the Gulf Coast, and people might say, well, I've got to get this little thing off my nose or my cheek. And you were saying you really need to watch who is doing that, because you want someone who's really trained in facial plastics to do those procedures.
Yeah, there's a lot of anxiety when you're having a skin cancer removed from your face. So we really take time with the patient, show them their expectations, and try to provide an outcome that gives the most pleasing aesthetic result.
Right, and you were saying to look as normal as, or right, to look as if you did before you had the skin cancer.
Correct, correct. You just want to design the flap or the way that you move the tissue to where it looks like they were before.
Right. Okay. Well, we are going to spend a lot more time with Dr. Kimberly Donnellan of USA Health on Facebook Live at 12:30. So you can ask your questions about anything related to facial plastic surgery. Just log on and join us there at 12:30. Thanks, Dr. Donnellan.
Thank you.